Hello, my name is Pauline. I'm going to be your nurse today.
Hello, nice to meet you.
Can I get your name and date of birth, please?
Yes, it's JD, and my birth date is way back August 1st, 1945.
Okay, and I'm going to check your bracelet to verify that.
Okay.
Okay, JD. Okay, August 1st. Okay, sounds good. Okay, JD, I'm looking at your chart here, and it looks like you are here for appendicitis. Okay, and you're about to get discharged. Okay, so I'm just going to teach you about a couple things. So, as you know already, this is an incentive spirometer. It's very important when somebody goes into surgery because what it does is it prevents somebody from getting an atelectasis, which is just a fancy word of saying either partial or full collapse of the lung.
That sounds very scary.
Yes, which is why we use this to prevent that. So what you're going to do, so I'm just going to teach you, and I would like for you to do this throughout the next week. If you can do this maybe every 2 hours. And I would say about 5 to 10 breaths every 2 hours, okay, if that's manageable, and that's very important. So what you're going to do, you're going to first release all of your breath, and then you're going to suck in the air here to keep this yellow portion right about in the middle. So you're going to go just like this. And the goal here is to keep this here, keep this white part going up slowly and just maintaining it right around this area, okay? Now, I'm not sure as to why this is all the way up here, but I'm just gonna bring it down for you here. So your goal as of right now is about 1,500 milliliters, okay? So I'm just gonna demonstrate for you.
I guess I've been doing it wrong. That was me that put it up to 20.
That's okay, and that's why we're doing that, so that way when you go home, you're going to be okay.
Okay.
I'm just gonna demonstrate one more time. So you're gonna release all of your breaths. And suck. Do you think you can demonstrate that for me?
Sure.
Okay. Just so I know that you're doing it correctly.
Okay.
Okay.
How is that?
That's not that good. So you don't want to do it too quick because then this rises all the way up. And you're just expanding your lung really quickly. The whole point is to kind of like keep your lung like this and then slowly open it up and close it down. That enforces you to take deep breaths. So you want to do it a little bit slower because you don't want this yellow portion to be all the way at the top. You want to kind of just bring it up, kind of just like when you breathe normally, and bring it down. And see if you can hold it around the 1,500 milliliter, maybe for about 5 to 7 seconds. And the more you do it, see if you can beat your time with that, okay?
Okay.
Okay, good. Okay, good. Good, very good. You're keeping the yellow portion in the middle, and you're keeping it at 1,500 milliliters. Very good. And see if you can hold it there for about 5 to 7 seconds. And I'm gonna count here, okay? 1, 2, oh, okay. That's okay, that's okay. That's normal after surgery. So your goal right now, so you've done for 2 seconds, so let's see if we can expand that next time for 4, okay? And that's okay if you don't get better with every hour. We're just trying to see an improvement over the next couple of days, okay?
All right.
Okay, so that's that with the incentive spirometers. That's for you to take home here.
Thank you.
And just something else that I would like to go over with you is signs of infection. So you have about 4 lap sites on your abdomen. So you want to leave the sterile strips on there, and you want to monitor if there's any excessive redness, pain that won't go away, swelling, bleeding. If you have any of those symptoms, please do call that number that we gave with you in your discharge paper. And that's all, okay? And a fever. If you have a fever, please do call about that, okay?
All right.
Okay, do you have any questions I can answer for you?
No. Thanks for teaching me how to do this properly.
Okay,
I was
yeah,
doing
absolutely.
it wrong these past few days.
That's okay, that's what I'm here for. Okay, I hope you have a good day. Stay healthy. No more appendicitis.
No. Thank you. It was nice
Nice
meeting
you
you,
too.
Take care.